Slide. So again, welcome in everyone. Thank you for joining us today. As you're coming in, please drop your name in the chat and where you're joining from, your state or organization or both. It's always nice to see all the many places people are representing on these calls. So again, welcome in and thank you for putting names and organizations in the chat. Okay, next slide. So again, welcome in. And if you're new to joining a Ripple Toolbox webinar, welcome. And if you're coming back, welcome back. This is Ripple's Rethink Health Toolbox series, a space to learn together and recharge. These Toolbox webinar series are a chance to hear directly from stewards, people on the ground doing the work, and to pick up ideas, tools, and inspiration you can take home to your own communities. Think of this hour as a working conversation. You'll hear, again, some stories, lessons learned, and honest reflection. So I really encourage you to ask questions and share what resonates with you in the chat. We'll also have some time at the end for you to ask some of the speakers some questions, but again, we'll uplift what we put in the chat as well. And again, we're not just here to talk about some of the challenges, what we know what's going on in rural communities, but to also spark new ideas. So again, welcome. Thank you. Next slide. My name is Tiana Moore, and I'm the Director of Systems Change here at Ripple. And I'll be joined by an amazing group of leaders today. They each bring a unique perspective from different corners of the rural health world, and you'll hear how they're navigating shifting resources, right? We know how things are right now, built partnerships that they've been building on, and more, all while keeping communities at the center of their work. And so I'm excited for you to meet each of them. I'll hand it to you, Colleen, first to introduce yourself.
Thank you so much, Tionya. It's great to be here today. Good afternoon or good morning, depending on where you're tuning in from. I'm Colleen Flynn. I'm the co-executive director of Build Healthy Places Network, and I'm really grateful to be with you today. And I'm joining from Asheville, North Carolina.
Thanks, Colleen. And Dr. Garrow and Annie?
Yeah, hi, good morning or good afternoon, everyone, wherever you're joining us from. I'm George Garrow. I'm a physician, and I am honored to serve as the Chief Executive Officer of Primary Health Network, which is a community health center in Western and Central Pennsylvania and Northeastern Ohio. Welcome.
Good morning, everyone. My name is Annie Eiffel. I am the Director for Healthier Glaze, which is a resident-led initiative funded by Palm Health Foundation located in Palm Beach County, Florida. I serve the Glaze communities of Canal Point, Pahokee, Belle Glade, and South Bay, Florida.
Thank you. Thank you. Next slide. So we always like to get an idea of who's in the room. So we're gonna launch a quick poll. If you can just answer where you're calling in from today, a rural community, if you partner with rural communities, or if you're interested in partnering with rural communities. Like we have a nice mix. So, nice mix in the room today. So again, thank you all for being here. Next slide. So again, I know I've said it plenty of times, but I'm so glad that you're all here with us today for this timely conversation about rural health and what it really takes for our communities to thrive. I just want to take a minute to ground ourselves in the bigger picture, right? And what's really happening across rural America. So much has changed in this last few years, but rural places are special, right? They're tight-knit, resourceful, and resilient. But we also know the truth that it's tough right now, right? Funding is shrinking, organizations are stretched thin, and people are tired, right? But at the same time, we're seeing incredible creativity, right? Neighbors are stepping up, local leaders are reimagining care, and people are refusing to give up on their towns and their communities. And so today is about uplifting those stories and learning how to build from them. This is a moment that calls for both honesty and hope, right? And learning from one another and remembering that thriving is still possible, even in these times, and even in the face of challenge. Next slide. And today is Rural Health Day. So happy Rural Health Day. It's National Rural Health Day. And so again, let's celebrate a win for that. Thank you. Next slide. So at Ripple, our purpose is simple but bold, right? It's to be a catalyst for future where all people and places thrive with no exceptions. And that includes the smallest towns and the most remote counties. And thriving shouldn't depend on your zip code. Next slide. At Ripple, we talk a lot about stewardship, and it's not just leadership, but shared stewardship, right? Stewards are people and organizations who take responsibility for working with others to create the conditions that everyone needs to thrive together, beginning with those who are struggling and suffering. And so my favorite part about the word steward is that everyone can be a steward. Anyone can be a steward, including each of you. It's about caring for the whole system together, right? Aligning across healthcare, local government, businesses, and even the residents, the core of it all, so that everyone has a stake in shaping a thriving future. Next slide. You can go to the next visual. So we start with the why, right? And we do that by focusing our efforts and partnering with organizations and individuals that are exercising their efforts to shift systems, beginning with those struggling and suffering, right? That's the why. And then we have the what, right? And that's through the vital conditions framework, right? And we often say that this is just a tool, right? It's not the be all to end all, but it's a tool to help moving forwards towards thriving. And the who, or the how, excuse me. And how we do that through each of you, right? Stewards, working together, connecting across differences, creating opportunities, and learning and adapting. Each of you driving again towards thriving communities. Next slide. So when you look at the visual here, you'll notice that the pieces connect, right? It's not one linear path. It layers and represents the parts of the communities that make things thrive. And belonging is at the center of it all, right? But meaningful work, lifelong learning, reliable transportation, and a healthy natural environment. The ideas are that these parts are not separate efforts, but they go together, right? They're the vital conditions that reinforce each other. And when they connect, communities get stronger. It's not just about health outcomes, but in well-being, hope, and opportunity. So the movement to thrive together is about weaving those conditions together in a more intentional way, right? Making sure that we're not treating health as a single issue, but as something that's shaped by everything around it, which are these vital conditions. Next slide. So thriving communities don't happen by accident, right? And here's the good news that you're not alone. And across the country, more and more organizations are embracing this vital conditions framework and shared stewardship. And rural communities are part of that larger movement to thrive together as well. Please don't feel bad,
because I did not perceive any of that.
Slide. And so I will pass it to Dr. Garrow to tell us more about the Primary Health Network.
Very nice. Thank you so much, Tiona. Yes, so as I said earlier, I am honored to serve as the Chief Executive Officer at Primary Health Network. Who we are a federally qualified health center, also known as a community health center, one of the largest community health centers in Pennsylvania. We serve both rural as well as urban communities through a multi-pronged approach, including our mobile approach to care, as well as dental, primary, specialty care, and behavioral health. Before you, you'll see our mission. And this is more than just words. This is something that takes me to work every day. Our mission is to enhance the health and the well-being of the communities that we serve by fostering trust and assuring that every individual has access to care that is high quality, compassionate, and exceptional. And we envision a future where healthcare is a transformative, personalized journey that embodies a comprehensive approach marked by unwavering integrity, respect for all individuals, continuous innovation, and a relentless dedication to quality. Next slide. So this is a graphic that shows our service area. For those of you who may be familiar with the layout of Pennsylvania, the dark green counties are counties in the state of Pennsylvania where we actually have a brick and mortar facility. The lighter green counties are counties that are in our service area, meaning that residents from those communities receive care at one of our health center sites. Pennsylvania is, a lot of people may not recognize that Pennsylvania is actually quite rural. Outside of the metropolitan areas of Philadelphia and Pittsburgh, a large swath of Pennsylvania is in Appalachia and is very rural. And that's what I call home. Next slide. These are just some examples of some of our health center sites. Some of them are large buildings. The one in the lower left-hand corner is our headquarters building in a community called Sharon, Pennsylvania, in Mercer County. And some of our offices are rather small. The building on the bottom right-hand side is our office in Andover, Ohio. And you can't really tell from that picture, but it's surrounded on three sides by cornfields. Next slide. So at Primary Health Network, we believe that health is more than what happens in the exam room. Health actually begins in daily life, in the relationships that we have, and in the opportunities for all of us to grow. We believe that every patient is a neighbor and that their story matters. We believe that by investing in the vital conditions that we can strengthen the fabric of our community's life. Our work is much more than treating illness. It's about care that is shaped by compassion, by connection, and by dignity. And that is why Primary Health Network and I are committed to building a system of care that's deeply human, rooted in hope, and guided by the people that we serve. Next slide. So I mentioned a little bit earlier our mobile approach to care. We believe that care is best provided at the right place at the right time. And we have been taking our mobile unit into the communities that you see here on the circles. Currently, we are mostly providing our mobile services to communities and partners in the community that care for individuals who are temporarily unhoused. Many of these communities are rural, and it's been an incredible experience for me to learn not only from the organizations that serve these communities, but the patients and residents of those communities about the value of relationships, compassion, and trust. Next slide. So just some examples of how we are bringing the vital conditions to action in our communities. We talk a lot about the importance of meeting the basic needs for health and safety in our communities. And just some examples of this, we are exploring and expanding opportunities to provide access to specialty care, such as dermatology, rheumatology, and neurology in rural communities by collaboration with organizations that do this so very well. We also are the proud recipients of a recent grant from HRSA, which is the federal agency that helps to fund community health centers like mine. And we were awarded a rural health outreach grant to open a primary care facility in a small town that's nestled along the Allegheny River in the beautiful part of Pennsylvania. And what's unique about this grant opportunity is that we are partnering with the local health system as well as the local independently owned pharmacy in the community to explore ways that we can improve care coordination, access to specialty care, and most importantly, creating a sense of connectedness and a positive experience for our patients. And then finally, recognizing that many of the communities that we serve are demographically older, and we care for a lot of older adults, we made a commitment to become competent in caring for older individuals. And so we have been recognized by the Institute for Healthcare Improvement as an age-friendly health system since July of 2019. Next slide. really to emphasize my belief in the importance of belonging and civic muscle. I have taken a personal initiative and a personal pride in the work that we're doing to try to increase belonging and civic muscle. But we all know that isolation and loneliness is a significant health risk factor. And so we have been partnering with organizations in our communities in what we call the Buddy Bench Project. We're putting benches in sacred spaces in the rural communities that we serve to create intergenerational spaces for connection. We're also working with stakeholders in one of our rural counties, Lawrence County, Pennsylvania, with a unique conversation, a series of roundtables on ways that we can collaborate to improve the health and health outcomes through a shared action commitment. And then finally, we have invested in a team of community health workers and community ambassadors that help us to connect our patients to the resources that they need in their community. Next slide. So our commitment is that we are aligning our organization's operations and services to operate within the vital conditions for health. That we're committed to strengthening our communities by addressing medical, health-related, and environmental needs. And most importantly, that we want to empower our patients, our families, and all of our staff to thrive in the communities that we're honored to serve. Thank you.
Great. I'm really excited to be here again today, and I do want to extend my thanks to Tiona and the Ripple Foundation for the opportunity to discuss this critical topic around stewarding rural health. So Build Healthy Places Network, we're a national organization that sits at the intersection of community development, public health, and healthcare. And our mission is to improve health and prosperity in neighborhoods across the U.S., and we do that through providing tools and resources for the field to create multi-sector partnerships that advance health through community-driven solutions. And we also support community practices for collective learning and action in community investment across sectors. Next slide. So many rural communities face challenges to meet needs around healthcare access, workforce development, financial stability, and infrastructure, just to name a few. Yet there's also a growing call to recognize all the strengths and assets and potential within rural communities. So shifting the focus from challenges to assets. So our vision at Build Healthy Places Network is to support creating multi-sector rural collaboratives that can address the social, economic, and health disparities, creating systematic change that really addresses the drivers of health inequities in these communities. And creating community-driven multi-sector partnerships doesn't happen passively or without input of effort, time, and resources. And we also acknowledge that rural communities are not homogeneous. For true rural development, we need inclusive strategies that recognize diversity and definitely drive competitive advantage. So what we think about is what could we achieve by intentionally aligning inclusive economic development strategies with efforts to advance rural health equity. And we explore the potential of expanding opportunities through these multi-sector collaboratives. So that's kind of the aim here. Next slide. So Build Healthy Places Network lifts up partnerships and place-based solutions that address the vital conditions in rural America. And we started supporting the work in rural areas in 2021. And we've expanded our work, highlighting local voices, supporting rural practitioners, sharing replicable models, so that rural regions can fully be included in national conversations around health and economic prosperity. Next slide. So two resources I just wanted you all to be aware of that I'll share in chat later. One is this playbook for new rural health partnership models of investment. And this is the first document of its kind that combines both case studies and institutional instructional tools on how hospitals and healthcare systems can be better engaged with rural partners, to really think about, again, advancing economic prosperity and health to use kind of their anchor institution role. And so this playbook and the recommendations and pathways presented Build Healthy Places Network with a lot of opportunities and new relationships in the rural space. So following up on that, we decided to do an update on the playbook, to go back and look at the partnerships to see if they are still collaborating and what's happening a few years later. So this update on the playbook just came out last year. And it taught us that despite of challenges, because COVID-19 happened around then, there's a lot of challenges currently with the lack of federal funding. Creativity and resilience of these collaborations remains, and it's actually opened up further partnerships in most cases. So through this case study work, we've been able to think about concrete projects that we can promote where multi-sector partnerships have come together. And we plan to develop in the future a regional rural action lab, again, that helps to support multi-sector collaboratives in rural areas. So please reach out to me if you might be interested in learning more. Next slide. So one of the case studies I wanted to talk about, because we overlay the vital conditions, we actually use vital conditions in all of our work and our framing, thanks to the Ripple Foundation and others, is a partnership with St. Alphonsus Health System and Leap Housing Trust in Idaho. Next slide. So this slide details a successful multi-sector partnership, and the emphasis in the intervention was a community land trust, which, if you don't know what a community land trust is, it's a shared equity model where homeowners own the house, but the trust retains ownership of the land, and this helps to ensure long-term affordability. And St. Alphonsus made a foundational investment of $240,000 from their community benefit and grant funds. And that seed of commitment attracted further investment, growing the total fund to over $2 million with participation of groups like Blue Cross Foundation. This initiative also has created energy efficient homes in the area. And the creation of this multifamily communities in rural areas, there's still some hesitation in these rural areas to have multifamily housing. And the healthcare system continues to work to kind of educate and do outreach to demystify these types of developments and what they bring. So given this context, purchasing availability of single family homes versus multifamily developments makes community land trust a great entry point for smaller rural communities to experience these innovative housing solutions. Next slide. So I did just want to spend a moment. As I mentioned, our case studies are powerful ways to illustrate the vital conditions in action. And so for this Idaho partnership, for instance, we saw humane housing, the equity retaining community land trust model, being the solution that allows residents to build generational wealth today, while fundamentally ensuring more long-term affordability for future buyers as well. As George was saying, this intervention also brings in the belonging and civic muscle that he was mentioning. This collaboration, actively reduces the stigma around affordable housing. It leveraged data, personal stories, brokered a lot of community coalitions so they can shape their own stories and powerful local messaging, and meaning, work, and wealth through the land trust model directly addresses local wage to housing affordability gaps by securing home ownership with built-in equity gains. So it creates a pathway to this economic prosperity I keep talking about and long-term stability for rural families. Thank you.
All right. Good afternoon, everyone. I'm going to tell you a little bit about Healthier Glaze, and particularly my relationship with the community that I love and born and raised in. just to tell you a little bit in regards to what is Healthier Glaze and how we came to be. About almost 8 or 9 years ago, we received funding from Palm Health Foundation that invested $1 million into 6 communities throughout Palm Beach County to invest in buildings, social capital, capacity building for residents in communities. And what we wanted to do is there was a focus on building that civic muscle in rural community in Palm Beach County. So we were launched in 2017. And so we are, when people think of Florida, people think of beaches. They think of the beaches, the town of Palm Beach, but there's a different side to Palm Beach County where we are very agriculturally rich. And we do have a lot of agricultural assets. So when I talk about the Glades consists of the communities of Belle Glade, Ahokee, South Bay, and Canal Point that is on the southeast part of Lake Okeechobee. We're also known as the winter vegetable capital of the world. So if you love corn, green beans, rice, radishes, lettuce, a lot of that comes from our community. When we first started, we asked residents in our community what they wanted to invest this money in. And they had a choice to choose between health and wellness, family caregiving, or behavioral health. And surprisingly, they focused on behavioral health. But one of the things we wanted to do is we didn't want to make it like a clinical or therapeutic. We wanted to focus on how can we change behaviors in our community that can bring about overall health and wellness. So our tagline, which is unlocking our community strengths, we wanted to make sure that we fit that tagline, to make sure that we are able to focus on the positive aspects of doing this work. And so we have a strong faith-based community here. Everybody is relational. Everybody knows everyone. So we tie into those national assets to try to bring about change. Next slide. So I wanted to bring a visual perspective of Palm Beach County in a way that you may not have seen it before. So if you are familiar with Mar-a-Lago, that is on the east coast of Palm Beach County, in the town of Palm Beach. As you start driving 45 miles west into Palm Beach County, you see the conditions look very different. So we go from more urban to more rural. Now, what you see on the slide here is Lake Okeechobee. So for those who are fishermen, you may have heard of Lake Okeechobee, but it's the largest freshwater lake in the country. And we are surrounded on the south end of Lake Okeechobee. Now, if you see the green patches of land, all of that is fields. So when you start coming into our community, you see acres and acres of agricultural fields that produce winter vegetables and sugarcane. So if you are familiar with Florida crystals, dominoes, sugar, that is grown out of these fields here in the Glades. And so we have a lot of natural assets. We're very close-knit. We're very protective of our respective communities. Next slide, please. Now, when we talk about Healthier Glades in particular, I serve as the director of Healthier Glades. I'm also a native of the Glades, born and raised in this community. So I get a chance to give back to the community that has poured into me. So when we reached out to community, say, hey, what are the things that we want to focus on? We definitely wanted to focus on health and wellness. We definitely wanted to focus on storytelling and changing the narrative of how people view the Glades region. And we also wanted to develop nurturing participation channels in the areas of advocacy, advocating for things that we want to see in our community, but also provide support for those who are in need of supports to bring about change. So a lot of my collaborations that I've done within the scope of Healthier Glaze, I tapped into my personal networks of people that I've known for many years. I tapped into my professional networks with my partners throughout the community, not only just in the Glaze, but throughout Palm Beach County. And I've also used my social media platform to try to get the word out and spread what we call the good news of the things that are happening in our communities. We do have several partnerships within Healthier Glaze that help us drive our work. So it's not the director doing it alone. We are distributing that wealth of collaboration to make things work and improve in our counties, in our community, excuse me. Next slide, please. Now, when we talk about local initiatives and partnerships, as I was stating earlier, when it comes to promoting health and wellness, I think this is one of our top areas that we've done a real good job with in terms of collaborating with FAU College of Nursing, American Heart Association of Palm Beach County, Diabetes Coalition of Palm Beach County, Empower Healthcare, and other community stakeholders to do hands-on health outreach through the churches with residents and community stakeholders. And what we realize is we use data from American Heart with their Healthy Communities initiative to address issues around metabolic syndrome. We use data from FAU College of Nursing to address issues around brain health. And then we also use data from the Diabetes Coalition to talk a little bit about diabetes. One of the things we're realizing that these are 3 major chronic areas that are impacting our communities. We have one local hospital, which is Lakeside Medical Center, that is a 70-bed facility with 6 ICU units. And so they just went into a partnership with Tampa General to try to bring more specialty care to the Glaze region and Palm Beach County. So just to give you that snapshot, that 170-bed hospital serves 4 communities with a population combined of the 4 communities of almost close to 40,000 people. And we also sometimes get patients from Clewiston, Florida, which is almost 16 miles further north. So this one hospital has to provide support to a lot of people in our area. And if we did not have this hospital, the next closest hospital was 30 miles away. When we talk about storytelling, we have a group of residents and community stakeholders that are collecting stories to hear from residents directly on how we live, work, and play in our respective communities, and then how to take these stories to bring about community change. For example, we had a story that a parent had expressed concerns about safety of their kids walking to and from school. We were able to take that story and build on a plan on how to address making walking to school safe for the kids in that community of South Bay, Florida. When it comes to developing and nurturing participation channels, one of the unique things that we are able to do is we provide grants, mini grants for residents, grassroots groups, nonprofits who've been in existence for 2 years or less to support what they're already doing in community and give them a way to give back with some funding and additional support from Healthier Glaze. We also make sure that we do community meetings where we get input from the residents in terms of telling them what we've been doing and let them give us input in what they would like to see us do more. And then we have partnered with Open Table to provide a support group, if you will, through churches to support families that are in need. Next slide, please. And so thank you for hearing my presentation, and I look forward to answering any questions that you may have.
Thank you, Annie, Colleen, and Dr. Garrow. That was awesome. I'm sure the audience enjoyed being able to hear all about the amazing work that you're doing. So we're going to jump right into the fireside chat. I'll kick off the first question. So given the current climate, right, and the challenges in rural communities, can you share an example of how the vital conditions framework or the vital conditions are shaping the way that you navigate your work right now? And even if there are any opportunities to expand. So, Colleen? I'll let you go first.
Sure, happy to. Well, I think Build Healthy Places Network is really grounded in the reality that health happens in communities and that health outcomes are shaped by a spectrum of factors outside of the doctor's office, especially challenging times right now with workforce, stable, affordable housing, transportation access, just to name a few. And we really feel like, the healthcare sector in rural geographies is an influential partner. Yet they also face, a crisis with a lot of rural hospital closures and ongoing challenges with workforce recruitment and retention that's directly impacted by housing and childcare options. So we really see the vital conditions for health and well-being, summarizes factors that all people depend on a fair opportunity to live their healthiest life and thrive. And in rural communities, these conditions and the close-knit ties that rural communities have that are deeply interconnected and embedded in the social fabric are all supporting the core foundation of belonging and civic muscle. So creating, again, these collaborative partnerships for rural revitalization, as well as building on existing relationships, we think can really deepen meaningful change and help to expand creative partnerships that truly reflect the unique context that all rural communities have and the social fabric and infrastructure, each rural community. Um, an example that we think is a great partner is the community development sector. In particular, they bring a range of financial resources, capital, with the potential to really coordinate with a lot of rural healthcare organizations to meet community investment goals and needs. So we think the future, get back to the part of the future of the question, are these innovative collaboratives, especially right now. I think we're all thinking about partnerships, solidarity, um, and we think we should emphasize participatory approaches as well and models that really think about community control, economic stability, so we can take deeper root and really, really flourish. And I'll pass it on to Annie.
Thank you. For Healthier Glaze, in looking at the vital conditions, we definitely focus on the health and wellness piece, as well as the belonging and civic muscle, because we want to make sure that our communities are engaged. We want to make sure that they're involved in the decision-making process on what they would like to see in their community. Too many times we have organizations that say, hey, we want this to be done in this community, but they have not had one conversation with the residents that live and work and play in that community. And so the unique thing and the thing that I love about the work that we're doing with Palm Health is that we have flipped that script and make the community be the ones that tell us what they want to see. So I think when we use that vital condition of belonging and civic muscle, as well as health and wellness, we're addressing two areas, because one thing, health is wealth. And if your health is not good, you cannot prosper. So one of the things we try to do is build that connection. And then with us being so removed in one of the third largest counties in the state of Florida, we are 50 miles away from the east coast of Florida. We're probably about 40 minutes away from the south and the north. So it's a large county. So we need to build those social connections to reduce that sense of isolation and loneliness in our communities, and use the natural assets that we have to bring about change. And I'll turn it over to Mr. George.
Thank you, Annie. What a great conversation. I just want to circle back to something that Tiona mentioned early in the how. And she mentioned about connectedness despite our differences. And for the audience, I'm going to describe to you what has been happening behind the scene. Colleen, Annie are doing such tremendously good work in their communities. And each of us are coming from different sectors in this rural health conversation. But just by collaborating and talking with one another in preparation for today's session, we have created connectedness and a community amongst ourselves. So here are three individuals coming from very different backgrounds and very different settings, and we have become a community. I consider Colleen and Annie and really all of the folks at Ripple my friends. And so I mentioned this because if we can come together and collaborate despite our different backgrounds, what unites us is our commitment, our compassion, and love for the communities that we serve. If we can do it, you can do it too. So I'll turn it over to Colleen for the next question.
I love that, George. Thanks for sharing. I feel connected too, and it is true what that can bring. So my question is, how can rural healthcare organizations effectively leverage their assets to contribute to inclusive rural economic prosperity and healthy communities? Amy, do you want to start with that one? I think you might be on mute. Yeah.
My apologies. I would say for us, in the work that I do, because everything, you have to be like a trusted voice in community. So you want to make sure that whatever you do, you bring your true, authentic self to the table. And so for me, in the work that I do, I have to rely heavily on what's in front of me, not make assumptions, try to bring about a way of listening to what's happening in community, and try to support them in bringing about the changes that they need. In response to the part about how to navigate in this space when you have so many different players at the table, you have to tread lightly, because in rural communities, sometimes we can be a little territorial. I love them, but we can. And at the same time, we don't want to step on people's toes. And so I always say my superpower is neutrality. And sometimes people are like, well, why would you say neutrality? Because one, I could come into these spaces and not show that I have a personal agenda. And if I'm supporting all communities and I show my actions that I'm supporting all communities, then I'm proving myself that I could be an asset and a trusted voice. So I'm not sure if that answered the question.
So one thought that I have, thank you, Annie. One thought that I have is that we've talked so much today about the importance of trust. And I hope that healthcare organizations can earn the trust of the communities that we're called to serve, and be a safe place for organizations really across the spectrum that are able to impact and influence the vital conditions, that healthcare organizations can bring that sense of trust as a safe place for individuals to sit across the table and to have dialogue and collaboration on ways that we can improve the well-being of our community.
Thank you, George. Yeah, people say that partnerships form at the speed of trust. So I think that's really, really valid. I'll just add from Build Healthy Places Network perspective that rural health organizations can also act as anchor institutions and economic drivers. So rural health organizations a lot of times are major employers, provide community infrastructure. So I think we can help them leverage their assets, if it's financial capital, if it's land, if it's data, again, beyond clinical care. One example from our playbook that I'll just mention is Stanford Health in Minnesota actually donated land for a veterans home and affordable workforce housing. And this land donation model actually inspired other healthcare systems to make similar anchor-based community investments in that area. Um, Rural healthcare organizations can lead these multi-sector investments that I keep talking about, to kind of try to move upstream. And then another thing I think that healthcare organizations can do is, kind of what George was saying, is really think about, to bring multi-sector partnerships together to really stop and make sure that they are having a centered community voice and that it's led by the community, that they're prioritizing community needs, since they can really reinforce their, influential role as a local convener as well. So that's what I would add. I'll turn it over to Annie for the next question.
Thank you. So, and I'm glad you talked about conveners, because for Healthier Glaze in particular, in our rural communities, we definitely try to stress the importance of being a community convener, if you will, and try to bring people together, because a lot of people have ideas, but they don't know how to go about getting things started. So the question that I have for you guys: what are some successful strategies for multi-sector partnerships in rural areas? And so I will turn that question over to the panel. But for me, I would say for us, definitely, we talked about this a lot, is the trust factor. We want to make sure that you build those strong relationships and that everything is community driven and locally relevant. You want to make sure that you're doing things that puts the community first and let the community lead the change, because as organizations and entities, we can come and go, but the communities are still there in their respective places. And you want to be able to build their muscle to continue what they want to do in their communities, even if for whatever reason we leave. So I'll turn it over to the panel to see if they want to answer that question as well.
Sure. Thanks, Annie. So some examples of some of the work that we've been doing. We've actually partnered with Penn State University. Penn State is one of a number of land grant universities in the country, and they have a real mission to work with the community. And we've actually partnered with Penn State and through their cooperative extension to have what we call community-driven research days, listening to the community and drawing stakeholders together. And as a result of that, we've actually been able to partner with some of the academic individuals at the university to create concepts and ideas that we could bring new innovation to rural communities. So one example. Another example is we've actually been partnering with government officials in the state of Pennsylvania. The Secretary of Health, the Secretary of Human Services, and I had been conducting a series of regional rural health summits in rural parts of the Commonwealth of Pennsylvania, really to listen to the unique needs of the communities. Educational academic institutions and government agencies have been a couple of examples of this multi-sector partnership as conveners. So Colleen, how about you?
Yeah, I'll add some ideas to that. I think one of the most important strategies to bring multi-sector partnerships together is having more value-based conversations. And we actually have a series of resources I can share later, but in a webinar we had over the summer, some of our panelists expressed that it's really important to communicate effectively, to really understand and clearly express your core values. Try to cut through all the jargon that's in the different sectors with plain language to build trust and come to a shared understanding. To really try to intentionally cultivate spaces that prioritize open dialogue, encouraging others to speak, to really illustrate how issues impact entire communities, not just individuals, just to be able to foster a broader sense of connection and a sense of urgency too, that something needs to be done. Another idea in that value-based idea is just to embrace productive tension and conflict so you can kind of forge through deeper collaboration and innovative solutions, really try to tackle complex challenges head on to ignite growth both, I think, personally and within communities. And I think that if you do that, you can kind of ground efforts in these shared values and struggles to build more connectedness, to think about collective action. So that's one that I'll share. I think the other I'll share is just we firmly believe that multi-sector partnerships really need to support local control. So thinking about community ownership models that help close the racial wealth and health gap. One example that we have in our playbook is in Nebraska. Winnebago Comprehensive Healthcare System teamed up with a community development organization to work on food sovereignty projects that's led to indoor farmers markets, home garden programs, a prescription program, and lots of other interventions by these two sectors coming together. The other thing I think is really important is think about how you can strengthen infrastructure to support healthcare access. I think that's a great strategy for multi-sector partnerships to come together. We have another example where Dartmouth Health in New Hampshire was able to identify a key issue of transportation. And so they actually provided funds that leveraged assets from different resources like local government for a rural bus route and invested in affordable housing collectively with various different sectors. So those are just a few that I'll mention, and I'll pass it back on to George.
Well, that's really great. Thank you, Tiona. Colleen, thank you. Tiona, I want to be mindful of time. We have one
Yes.
question, but I actually think Colleen and Annie answered it so very well about the voice of the community. So with that, I'll turn it back to you.
Thank you. Thank you all for your amazing responses and just sharing about the work that you're all doing in each of your communities. And to George's point, we do have 5 minutes left. So I am going to open it up to the room to see if anyone has any quick questions or want to share anything that resonated with them. There were a lot of great things that were shared in the chat. So yeah, I'll give folks a minute or two if they want to come off mute and share anything. I know there was a great resource that was put in the chat. My colleague suggested I uplift.
I just wanted to reiterate the importance of the faith-based community, as they are providing a lot of services. And I know Annie is, and I put that in the chat, involved with the Glades Ministerial Association. But for those of you that aren't familiar with Palm Beach County, and particularly the calls we get into 211, housing is such a huge need, affordable housing. And one of the projects in the community itself is working with faith-based or churches that have property to build affordable housing. And this seems to be something that has gotten traction. And hopefully this can be implemented in the Glades as well. And so I just think that having safe housing is so important to health.
Absolutely. It's one of the vital conditions. Let me see. If there isn't anyone else, I know there was the trustee worthiness toolkit. Carla, I'm not sure if you're still on the call and want to speak to it.
I am.
So do you want to share a little bit about that or the resource?
Sure. So the principles of trustworthiness were developed in 2021 by the AAMC Center for Health Justice, recognizing that, as you all have mentioned, everything moves at the speed of trust, and that trust is something to be earned and not to be demanded of, and that it has to be built over time. And so these 10 principles were conceived with the input from Charge, which is a collaborative for health equity, and I can share that link later, about 2,000 professionals and community members across the nation who are interested in health equity. And we tap them to first assess, what makes you trust anything, anyone. And then from then on, we gathered the information. There was a bit of a analysis of the input or the feedback that we received. And we searched for a nationally representative sample of people so that they could also weigh in and share what makes institutions trustworthy, what foments trust in people, in community. And so after getting that national representative data, the information was again distilled, and these 10 principles arose. Then we shared these principles and we wanted to test them in a way, is it resonating if at the point of implementation of the toolkit, we list the 10 principles and we mention how entities can go about them. And they're sector agnostic. They're not just for health systems or healthcare organization. And so we had we had 5 communities across the nation who engaged in a year-long process of, let's see, when you deploy the toolkit, what happens, what needs to be tweaked, what needs to be revised, what's resonating, what's not. And after that year, then we revisited the principles. And in the course of that time, thankfully, they garnered enough traction that the CDC included it in its Principles of Community Engagement book in their 3rd edition. And so they've been recognized at the national academies, which we know are somewhat removed from true community, but if you will, it's a community of educators, of academics, of people involved in population health and health equity. And so then after this was implemented and we evaluated and we were recognized by the CDC in their Principles of Community Engagement, then it was revisited, they were relaunched, and they're on our website. And so we provide, in a way, a guidebook of, if are you meeting these principles, how can you meet them, how can you operationalize them for your purposes. And if anyone is interested, I can share my email and I can further maybe set up a talk or set up a meeting with my team such that we can walk you through or have some sort of discussion or even a presentation about them. And I'll share my email shortly.
Thank you.
But thank you for letting me explain a little bit about that.
Yes. Thank you so much. And I know we are at time, but I just wanted to share a few key takeaways, as you all can see here on the screen, right? The multi-sector partnerships are used, community-centered approach, and leveraging those healthcare assets, and just understanding that even small shifts, right? New partnerships, shared storytelling, showing up differently can change what's possible. So thank you all for being here today. If you have a minute or so to hang back to just complete the survey, we'd really, really appreciate it to get some feedback on how today landed for you all. One thing I was going to share, again, we didn't have much time, is about continuing a conversation like this, right? It was super timely and I feel like a really fruitful conversation. How can something like this be continued as it relates to rural health? So if you're interested, please do reach out to us. But yes, thank you all for being here and happy National Rural Health Day. Thank you.